In this video, we will be talking about the genomic analysis of COVID-19 from the group Nextstrain. For the full report, please visit the website. In this report, we analyzed 410 publicly shared COVID-19 genomes. By comparing these viral genomes to each other, we can characterize how COVID-19 is evolving and moving around the world. In this report, we show that the virus is widely circulating across the globe, with evidence of local transmission on multiple continents. At this time, we urge focus on efforts to slow the spread within communities. Travel bans are less likely to be effective. COVID-19 is circulating widely across Europe with significant movement between countries. We also identify at least 4 introductions to the UK. There has been a number of travel-related cases linking Iran to other parts of the world. There have been many introductions into the US to date, resulting in local transmission chains in multiple states. The outbreak continues to grow in Washington state. Some cases are closely related to those from the Grand Princess cruise ship. There has also been local circulation of COVID-19 in California. Social distancing measures should be enacted swiftly to ease the burden on healthcare systems and protect the vulnerable. We currently have sequences from samples taken in 30 countries across 5 continents. This is an incredible feat. Sequencing an unknown, large RNA virus in the midst of a pandemic is difficult. For example, the map shows very few sequences from the global south. This is not because COVID-19 isn't circulating in these areas, or that these cases are not as crucial to understand. Rather, we just don't have much data available from these areas. The size of each circle on the map indicates how much data is currently available from that area, rather than the true size of the outbreak. Here, we see a large clade of sequences from Europe. Notably, sequences from many different countries intercalate, indicating that COVID-19 is already circulating quite widely across Europe. Zooming in on the map, we can see that there are many links between Italy and other areas. However, it is important to keep in mind that the directionality of these links can't always be confidently inferred. Other hypotheses can also explain these data. For example, if an unsampled case infected both a secondary case sequence in Italy and a secondary case sequenced elsewhere. When looking at British Isles and Ireland as an example, we can see several instances where viruses that are closely related to samples from other countries appear in the British Isles and Ireland. This is consistent with 4 or more introductions from other locations. We also see instances where after an introduction, there are several closely related cases from the same location. This is consistent with local community transmission from more than one of these introductions. A number of genomes have been sequenced from patients reporting travel history to Iran. These genomes are all extremely similar and indicate that the outbreak in Iran may be the result of a single transmission which has subsequently been transmitted to other places. We can see that the virus has been introduced to the US on multiple independent occasions. Most of these introductions aren't associated with any other sampled cases from the US, so we're not sure if these introductions led to local outbreaks. However, given that testing capacity is not yet ramped up in most areas, we expect that there are many unreported cases. For Washington and California, though, we do see clusters of cases that are closely related. This suggests ongoing transmission and local spread within these 2 states. Here, we see a large cluster of cases from Washington that are closely related. From this, we conclude that there is extensive local spread within Washington state. Interestingly, the Washington samples intercalate with samples from the Grand Princess cruise ship. We aren't sure yet whether the virus spread from the cruise ship to Washington or the other way around. As we get more data, we'll update our analysis. Looking at samples from California, we see evidence for multiple introductions. More importantly, we see at least one cluster of closely related cases, all sampled in California over a short time period. This strongly suggests that there is ongoing local transmission within California. So what can you do? The virus has been introduced to many parts of the globe multiple times. Not all introductions result in local transmission. We see evidence of local transmission across Europe, parts of the United States, China, and Southeast Asia. Controlling local outbreaks through social distancing is crucial to protect the vulnerable. Here are some steps you can take. Reduce the number of people you are in contact with each day, especially if you are in the vulnerable group. Remember that even if you're not super vulnerable, many people around you are. Follow these practices to protect others. Wash your hands like you just chopped a jalapeno and have to change a contact lens. Stay home if you're sick. Be prepared with a few extra supplies in case you need to self-quarantine. If you are an employer, encourage your employees to stay home when sick and financially support them to do so. Some other steps that officials can take are to make testing free and broadly available, put social distancing measures in place, and financially support those impacted by social distancing measures. We know that a lot of people have questions about COVID-19. On the Nextstrain website, there is a guide to try and answer the most frequently asked questions. A number of misconceptions have been circulated about the origins of the novel coronavirus. During outbreaks like this one, the spread of information that's known to be incorrect can lead to more panic and cause people not to trust scientists and governments, meaning they are less likely to follow advisories and take appropriate precautions. We would like to acknowledge the amazing and timely work done by all scientists involved in this outbreak. We will report weekly updates on the Nextstrain website.